Good evening and welcome back to the New York Immigration Coalition Test, Trace, and Take Care video series. My name is Lovely Tejada, the Director of Community Engagement at the New York Immigration Coalition, and I will be your host. You can access our previous content on testing, tracing, and best practices to care for yourself or a loved one with COVID-19 here on our organization's YouTube account. Each video has Spanish, Mandarin, and English subtitles. Per CDC and New York State guidelines, fully vaccinated people are no longer required to wear their masks except in certain settings. Vaccinated and unvaccinated people must keep their masks on in schools, public transportation like the subway, healthcare settings like hospitals, and congregate settings like nursing homes. In New York City, we're also keeping mask rules in place for city workplaces for now. Follow this simple, smart advice. If you're fully vaccinated but don't know if everyone around you is too, keep your mask on. And if you're vaccinated but want to keep wearing a mask in all settings for whatever reason, that's fine too. If you are not vaccinated, you should continue wearing a mask whenever you leave home. Continue getting tested regularly, avoid gatherings, and maintain physical distancing. Find the vaccination site near you at vaccinefinder.nyc.gov. Anyone age 12 or older can get the vaccine at no cost. You do not have to show any proof of residency or a social security number. You do need to show proof of age, though an adult can say how old a child is. And COVID-19 vaccines are available all over New York City by appointment, without an appointment, or at home. Call the New York City vaccine hotline at 877-VAX-4-NYC or 877-829-4692 to get an appointment for yourself or someone else with assistance in multiple languages. None of the authorized and recommended vaccines contain the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID-19. COVID-19 vaccines teach our immune systems how to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms, such as fever. These symptoms are normal and are signs that the body is building protection against the virus that causes COVID-19. Please visit the CDC website to read a comprehensive breakdown on how our mRNA and viral vector vaccines work. All the vaccines authorized by the US government were carefully tested to make sure they're both safe and effective, just as with any vaccine or drug. All COVID-19 vaccines were carefully evaluated in clinical trials and will be authorized or approved only if they make it substantially less likely you will get COVID-19. Based on what we know about vaccines for other diseases and early data from clinical trials, experts believe that getting a COVID-19 vaccine also helps keep you from getting seriously ill, even if you do get COVID-19. Experts continue to conduct studies to learn more about how COVID-19 vaccination may reduce spread of the virus that causes COVID-19. The vaccines cannot give you COVID-19. They do not include microchips, and they do not change your DNA. There is no evidence the vaccines could hurt people who are pregnant or breastfeeding or their fetuses or newborns. Based on what we know about vaccines for other diseases and early data from clinical trials, experts believe that getting a COVID-19 vaccine also helps keep you from getting seriously ill, even if you do get COVID-19. Getting vaccinated protects your family, friends, and community. Getting vaccinated yourself may also protect people around you, particularly people at increased risk for severe illness from COVID-19. Getting vaccinated allows you to have close contact with others. 2 weeks after your final vaccination, you can safely spend time with family, friends, and strangers, even indoors and without masks, with little risk of getting sick with COVID-19. People who have not been vaccinated should still wear masks in public and stay 6 feet away from people they do not live with. Getting vaccinated will help end the COVID-19 pandemic, just as earlier vaccines eliminated polio and smallpox. As more people get vaccinated, it will become harder for the COVID-19 virus to spread from person to person. We will be able to safely reopen schools and businesses and get back to normal. The risk of getting COVID-19 is much greater than the risk from any side effects you could get from a vaccine. COVID-19 has already killed over 500,000 people in the US, including hundreds of children and thousands of young adults. Over 33,000 of our neighbors in New York City have died of COVID-19. In clinical trials, none of the people who received the vaccine became severely ill with COVID-19, but many people who did not get a vaccine became severely ill with COVID-19. In these trials, people who received the vaccine were much less likely to get any symptoms of COVID-19 than people who received the placebo. All the vaccines are very effective at preventing you from getting sick with COVID-19. With the Johnson & Johnson vaccine, you only need to get one shot. With the Pfizer and Moderna vaccines, you get 2 shots 3 or 4 weeks apart, depending on which vaccine you selected. The second dose boosts the effectiveness of the vaccine. Common side effects. Many people experience mild side effects after getting a COVID-19 vaccine, like a sore arm. You may also experience symptoms like fever, chills, headache, or body aches, particularly after the second shot of a 2-dose vaccine. These symptoms are normal and are a sign your body is getting ready to fight off the virus that causes COVID-19. Symptoms usually go away within a day or two. Rare side effects. We're still learning more about serious side effects, but we know they are very rare. Out of every million people who get a COVID-19 vaccine, only a handful have severe allergic reactions. Blood clots. Rare cases of blood clots in women caused the U.S. government to pause the use of the Johnson & Johnson vaccine. After careful study, the government decided the risk of blood clots was much smaller than the benefit of how well the vaccine protects people from getting sick with COVID-19. The vaccine is available again, or you can choose to get a different vaccine. Reporting side effects. People and their doctors can report side effects to the government to the Vaccine Adverse Event Reporting System listed on screen. Scientists are investigating these reports and so far have found that life-threatening side effects are incredibly rare. Other illnesses after vaccination. Hundreds of millions of people have been vaccinated, and in such a large group, some people will experience illness that has nothing to do with the vaccine or COVID-19. A few people have become sick or died after getting a COVID-19 vaccine, but scientists do not think the vaccines are to blame. Who should not get a COVID-19 vaccine? People are encouraged to speak with their healthcare provider if they have a serious allergic reaction to an ingredient in a COVID-19 vaccine in the past. Please visit the CDC website for the full list of ingredients for each vaccine. The CDC says the vaccines are safe for people with common health conditions such as diabetes, heart disease, lung disease, HIV, or cancer. For these people, the vaccines provide more benefit because getting COVID-19 is even more dangerous. If you're worried about getting the vaccine because of an allergy or other health condition, you can speak to your healthcare provider or call 311 to talk to a clinician at the New York City Health Department. People who say they will not get a COVID-19 vaccine. To protect yourself and others, you should wear a mask and stay at least 6 feet away from people you do not live with. If you're not vaccinated, you're more likely to get sick with COVID-19 and to pass the virus to other people. People who are not ready to get vaccinated right now. You can take your time and figure out when you are ready to get a COVID-19 vaccine. Make sure you take steps to not get COVID-19. You should wear a mask and stay at least 6 feet away from people you do not live with. You can talk to your friends who have had the vaccine and anyone you know who got sick with COVID-19. Be careful not to believe everything you hear from others or see on the internet. Get accurate information on the vaccines from your healthcare provider or from the CDC or New York City websites. People who already had COVID-19. Getting a vaccine will protect you even if you already had COVID-19. People can get COVID-19 more than once. Having had COVID-19 does help protect you from getting sick again, but getting a vaccine protects you even more. People who are not worried about getting sick with COVID-19. COVID-19 can be very dangerous to anyone who is not vaccinated. Thousands of young adults have gotten very sick or even died. Even people who have a mild case of COVID-19 may have health problems later on. Even if you're not worried about getting COVID-19, getting the vaccine also helps prevent you from getting the virus and passing it to others. People who worry about vaccinating their children. Vaccines prevent all sorts of disease in children, and the COVID-19 vaccine is just the latest. Vaccinating adolescents is important because they can get sick from COVID-19 and can spread it to others. There's no reason to think vaccines can hurt a child's health, but we worry that even a mild case of COVID-19 may cause health problems later on. The Pfizer vaccine is available for children aged 12 and older, and vaccines may be authorized for younger children. People who are mistrustful of the government or medical system. There is a long history of governments and doctors providing poor treatment to people who are poor, Black, Latinx, and Indigenous, even experimenting on them. But we know COVID-19 vaccines save lives and are safe. Helping everyone get vaccinated is the best thing we can do to prevent more sickness and injustice around COVID-19. The vaccines work for everyone. All vaccines were studied among people of different ages, races, and ethnicities. What is not yet known about COVID-19 vaccines? The duration of immunity provided by the vaccination, whether additional doses will be needed in the future, the safety and the efficacy for children under 12, and the efficacy in persons with immunosuppression. When you're fully vaccinated, all activities become safer. Generally, you no longer need to wear a face covering or stay 6 feet apart from other people. We recommend you continue wearing face coverings indoors until more people are vaccinated. Outdoor activities are much safer without a face covering. Face coverings are still required in schools, on public transportation, in healthcare settings, and in congregate settings, such as nursing homes and homeless shelters, and at any other setting so designated by a business or location. Keep your face covering on if you are around unvaccinated people who are at increased risk for severe COVID-19. You no longer need to quarantine after exposure to someone with COVID-19, and you no longer need to get tested for COVID-19 unless you have symptoms of COVID-19 or testing is required for work, school, or a specific activity. Fully vaccinated people can participate in outdoor activities and recreation without a face covering, except in crowded settings. They can gather indoors with other fully vaccinated people without face coverings or physical distancing, gather with people from other households without face coverings or physical distancing, even if members of the other household are not vaccinated, provided that no members of the other household are at increased risk for severe COVID-19 illness, forgo quarantine after an exposure to someone with COVID-19, and forgo routine screening for COVID-19 unless they have COVID-19 symptoms or testing is required for work, school, travel, or other reasons. Fully vaccinated people should continue to wear a face covering while indoors, public spaces, or in crowded settings. Stay home if they're sick. Stay at least 6 feet from others whenever possible when in a public setting. Practice hand hygiene, and learn more about the benefits of vaccination on the CDC's webpage about choosing safer activities. If you're still unsure about the vaccine, The Conversation is hosting community conversations to build vaccine confidence among community members. Please visit greaterthancovid.org to hear answers to your questions from Black and Latinx doctors, nurses, and promotoras in English and Spanish. There are now walk-in appointments available at all city sites. Check on.nyc.gov/walkupvax to find an option that works for you. For city-run sites that require an appointment, please visit nyc.gov/vaccinefinder. If you have any questions, visit nyc.gov/health/coronavirus or call 311. New York City is offering incentives to encourage more New Yorkers to get the COVID-19 vaccine. Individuals who receive their first vaccine dose on or after May 25th at New York City run sites are eligible to choose one of the incentives and enter a competition to win exclusive prizes. Once their first COVID-19 vaccine dose is complete, individuals will receive emailed instructions on how to select their incentive and how to enter the competition. As of May 25th, New Yorkers can choose from the following incentives: free tickets for the New York City Football Club, Brooklyn Cyclones, New York City Ferry 10 Ride Pass, Top of the Rock, and Liberty Island. Memberships to Public Theater annual membership, 2-week membership to City Bike, and Snug Harbor family membership. In addition to these items, New Yorkers getting their first dose at certain city-run pop-up sites will also be able to get free tickets to the city's top cultural and tourist destinations like the Bronx Zoo, New York Aquarium, Brooklyn Museum, New York Botanical Garden, and Brooklyn Botanical Garden and Lincoln Center. New Yorkers who have already been vaccinated can take advantage of other discounts and giveaways from great New York City businesses like Shake Shack and Crunch Gym by simply showing their CDC card. New York City COVID-19 vaccine site locations for youth shows city-run sites offering vaccination for people aged 12 to 17. For more sites, go to nyc.gov/vaccinefinder. FYI, the site does not work on Internet Explorer, and search by vaccine type Pfizer, or call 877-829-4692. Please check out this document for frequently asked questions and vaccination sites for youth vaccination. And that concludes the presentation. Now we'll take a few questions from the audience. Can vaccinated people still get COVID-19? So people who get a COVID-19 vaccine have a much lower chance of getting the virus that causes COVID-19, but a few will still get the virus. If you do get COVID-19 after vaccination, you're much less likely to get very sick and less likely to pass it to others than someone who didn't get the vaccine. I don't trust the vaccine yet. How do I know it works? So scientists built off decades of research for other vaccines while developing COVID-19 vaccines. The vaccines went through large clinical studies involving tens of thousands of people of different ages, races, and ethnicities. And these studies show the vaccines are safe and very effective at protecting people from severe COVID-19 illness, hospitalization, and death. We know the vaccine prevents severe illness and death from COVID. In New York City alone, over 6 million shots have already been administered, and we're seeing case rates, hospitalizations, and death decrease. We know that vaccines save lives from the effects of COVID. I don't think it's worth the side effects. I won't get that sick from COVID. So, severe side effects are extremely rare. The most common side effects are mild and don't last long. All people are vulnerable to the effects of COVID, which can include severe illness and death. It's difficult to guess how COVID will affect you, and many have no or few symptoms, but scientists don't yet know the long term effects of having COVID, and others have severe symptoms that are worse than the side effects of the vaccine and can end up in the hospital or lead to death. The COVID vaccine isn't just about protecting yourself, it's about protecting your family and your loved ones. By getting vaccinated, you may help avoid exposing vulnerable individuals around you to COVID. We need to stop the spread to keep people safe and to get New York City moving again. I'm worried about getting COVID from the vaccine. You cannot get COVID-19 from the vaccine. The vaccine does not contain the virus. It teaches your body's immune system how to fight the virus so it can fight the virus if you're exposed to it. I don't believe in vaccines. So I understand your concerns, but did you know that many diseases that used to be common in this country and around the world, including polio, measles, diphtheria, and countless others, are now prevented by vaccination? Thanks to a vaccine, one of the most terrible diseases in history, smallpox, no longer exists outside the laboratory. Over the years, vaccines have prevented countless cases of disease and saved millions of lives. It's always better to prevent a disease than to treat it after it occurs. I'm worried about the cost. It's free. Anyone in the US who is 12 and older can get vaccinated at no cost here in New York City. You do not need to have insurance or share your immigration status to be vaccinated. I want my doctor to give it to me. So Department of Health sites are all staffed by nurses and doctors and other medical professionals, but many doctors and pharmacies in New York City do offer the COVID vaccine now, including federally qualified health centers nearby. You can visit mieligible.covid19vaccine.health.ny.gov to help you find one. I don't have an ID and I don't have a social security number. You don't need one. You just need something that shows your age. You don't need to provide proof of immigration status or a social security number to get vaccinated. You just need to show proof that you're 12 years of age or older. I'm not a citizen and I don't want my information shared. So you don't need to be a citizen to get vaccinated. Anyone who lives in the US is eligible to receive a free COVID vaccine here in New York City if they're 12 years of age or older. And the eligibility questions do not require any proof of citizenship, and your information is protected by medical privacy laws. I'm worried the vaccine causes infertility. So people who are trying to become pregnant now or in the future should get vaccinated. Vaccines do not cause infertility, and there has been no reported evidence showing otherwise. The COVID-19 vaccines, similar to many other vaccines, work by teaching our body to create antibodies to fight the virus. Concerns of infertility are based on the misconception that the antibodies developed after COVID-19 infection or vaccination will attack a protein in the placenta. However, the proteins on the virus that causes COVID-19 and the protein in the placenta are very different. And our immune systems are smart enough to tell the difference. There's no evidence these antibodies will cause any problems in pregnancy, including development of the placenta. I don't want the Johnson & Johnson vaccine because it's not safe. It is safe and it's effective. There were some cases of a rare type of blood clot, but this was only 15 cases out of nearly 8 million doses. Experts and scientists reviewed the cases and determined the benefits of vaccination outweigh the risks. The decision was based on a recommendation from the U.S. Advisory Council on Immunization Practices and a decision by the U.S. Food and Drug Administration and Centers for Disease Control and Prevention to lift the pause on administration of the vaccine. This is the vaccine system working exactly as it should. Events are reported nationally, and the actions taken reflect how seriously we take signals from our warning system. Healthcare providers are asked to report adverse events to the Vaccine Adverse Event Reporting System. But you do have a choice, and you can find a location that has a different vaccine. I don't have a way to get to a vaccination location. So if you're 65 or older and cannot use public or private transportation and don't have anyone to take you to your vaccination appointment, other free of charge transportation options are available. If you use Access-a-Ride, Medicaid provided or Medicare provided transportation, you can schedule rides as you normally would. If you do not use Access-a-Ride, Medicaid provided or Medicare provided transportation, you can schedule a free ride to their vaccination site through the New York City vaccine hotline at 877-VAX-4-NYC or 877-829-4692. And to schedule transportation through these options, you should call and state that you're 65 or older, going to be vaccinated in New York City, and that you understand that there's a contract with the City of New York for free transportation. I can't take time off from work to get vaccinated. So all New Yorkers are entitled to paid time off from their employer to get vaccinated. You can speak to your employer to make a plan to get vaccinated. And if you have any questions, you can call 311. I already had COVID. I don't feel like I feel like I don't need to get the vaccine. So you absolutely should still get the vaccine. And that's because you can get reinfected with COVID. The vaccines help protect from future infection, and it's the best way to protect yourself, your family, and friends. The vaccine may boost the protection your body has already built up. How long do I have to wait to take the vaccine if I've already had COVID-19? So if you currently have COVID, you should wait until you have recovered and completed your isolation to avoid exposing other people at the vaccination site while you're contagious. And after that, you're good to get vaccinated. I want to choose which vaccine I get. Can I choose when I get to my walk-in site? You get to choose. So when you search for a vaccination site, you can see which vaccine they have available. So elect the location that has the brand you prefer, and it's that easy. Why do I need 2 doses of Moderna or Pfizer and 1 dose of Johnson & Johnson? So there are different kinds of vaccines, but all 3 are very safe and effective. The second dose of this type of vaccine strengthens the immunity you get after the first dose of Moderna and Pfizer. You can also choose Johnson & Johnson, which is a single dose vaccine and doesn't require a second dose to be fully effective. The most important thing is to get protected from infection by getting a vaccine, and you can choose any of the 3 vaccines available. Do people ages 12 to 17 need permission to get vaccinated? Yes. A parent or guardian must give consent. Consent can be given in person or at the time of the appointment. And some vaccination sites also accept written consent, including all city-run sites. Youth ages 12 to 15 must be accompanied to the vaccination site by a parent or guardian or another adult caregiver chosen by the parent or guardian. And the young person will need proof of age, such as a birth certificate or an ID with their date of birth. And if they don't have proof of age, a parent or guardian can attest to their age. You do not need to share your immigration status to be vaccinated. Great. Well, it doesn't look like there are any more questions in the chat. Thank you for tuning in and helping share accurate messaging about New York City's test and trace efforts. Please continue to download and share our Test and Trace 2-pager, available in Arabic, Bengali, Creole, Mandarin, Spanish, and Russian, and share accurate information on how to prevent the spread of COVID-19. To stay involved with the New York Immigration Coalition, follow us on Facebook, Instagram, and Twitter, and text NYIC to 52886 to stay up to date with our actions and campaigns. Stay safe and enjoy your evening.